When it comes to managing autoimmunity, there are three various stages that we can grade and then ultimately monitor. First up, you have silent autoimmunity. Next up, you have autoimmune reactivity. And lastly, we have full blown autoimmune disease. And oftentimes, it can take upwards of 25 years to progress from stage one all the way to stage three, or it could happen overnight. So let's dive into each stage. Something that you will find across all stages is the presence of antibodies. The analogy that I often utilize is think of an antibody like a yard sale sign that you stake down in front of your home. All that sign does is advertise that you're having a yard sale, but it doesn't necessarily mean that people will show up and buy anything from you. An antibody works in the same sense. An antibody is just a sign that gets staked down on a particular tissue within your body to alert the immune system to come and destroy that tissue. But that doesn't necessarily mean that your immune system will do that. In fact, sometimes higher levels of antibodies are protective. But we'll talk more about that in another video. So let's start off with stage one. This is silent autoimmunity. And that is where you have elevated antibodies on blood work, but you're not yet experiencing any symptoms or loss of tissue. This is obviously where we would like to find things, but oftentimes people aren't going to go to the doctor until they're already experiencing some sort of symptom, meaning they would have already progressed past this stage. Then, once we progress into stage two, also known as autoimmune reactivity, again, the patient already has elevated antibodies, but now you're starting to notice symptoms. But the gland has yet to be destroyed. This is obviously a little bit worse since you're now starting to notice symptoms, but you've yet to experience any destruction of tissue. Meaning, if we stop the progression now before losing any of the actual gland, the outcomes will be much greater. People in this stage typically have some days that are better than others. You could have a streak of bad days and a streak of good days, and you may not always know why. You could experience a flare from a food you ate, or a stressful life event, or maybe a new laundry detergent, or maybe it's just a combination of a bunch of different things. Then, as we progress into stage three, this is where you have full blown autoimmune disease. Once you reach stage three, this is where you not only have elevated antibodies as well as symptoms, but now you have destruction of that tissue. And this is where autoimmune disease will officially get diagnosed in the traditional medical setting. Now, this is an unfortunate situation because it's not until your tissues becomes totally destroyed that you get diagnosed with an autoimmune disease. And as you can imagine, once the tissue is no longer present because it's been destroyed, now making any significant progress has become much more difficult. Things become blatant in stage three. Your MRI shows clear plaquing with MS. X rays show clear RA. Type 1 diabetics can no longer produce insulin. And in many of these situations, you have to have significant destruction of that tissue before getting diagnosed. For example, with Addison's disease, which is an autoimmune adrenal gland disease, you have to have 90% destruction of that tissue before meeting the diagnosis. I hope you can see how they're literally setting you up for failure right out of the gate. Because let's say that you only have 60% destruction. These people have low blood pressure and fatigue and cold hands and cold feet and dehydration and exhaustion probably for many, many years, and they can't figure out why. So your doctor basically says, like in a roundabout way, let's just wait until you feel a little bit worse. And in that time, you'll continue losing part of that gland. And hopefully, when you come in next time, you meet the criteria for the diagnosis, which means now you can get treated. Can you see how broken that system is? Why would we want to wait until you get worse when we could intervene at the early stages and make so much more progress? When it comes to looking for these various stages, the one thing that is consistent across all stages is the presence of antibodies. So if I have a patient who I'm skeptical may indeed have an autoimmune disease, I will recommend running the laboratory markers to screen for autoimmunity. And this becomes an open dialogue between the patient and myself because what we could do is screen for individual antibodies like TPO and TGB with Hashimoto's, or myelin basic protein with MS, or intrinsic factor with pernicious anemia, and on and on. Or what I really like doing is running a test called the Cyrex Array 5. Why I really like doing this test is because it screens for 24 of the most common antibodies, ranging from your brain to your thyroid to your heart to your intestines to your joints. And what you then have is it then gives us a more thorough picture of the battle that we're up against. This isn't a cheap test though, so I have to weigh the pros and the cons with each patient and basically ask myself, at the end of the day, will more data change my treatment plan? And if not, it may not be necessary. However, remember that in stage one, silent autoimmunity, you have not yet experienced any symptoms. So let's say that you have antibodies towards arthritic peptide, which is in rheumatoid arthritis patients, but you don't have any pain or swelling of your joints yet. If we run the Array 5, we could then find these antibodies and use that data to fine tune your management plan. What do I mean by that? Well, remember, the only thing that's different between stage one and stage two is that you start to notice symptoms. And if we can identify a tissue that is in stage one, let's just continue using arthritic peptide antibodies come back, but you don't yet have any symptoms. So now if you start noticing symptoms or swelling or pain in your joints, You can say to yourself that something in my daily life is contributing to the progression of my autoimmune disease, and then work your way back to say, was it a food, a lack of sleep, a new laundry detergent, lack of exercise, whatever, and then eliminate whatever that trigger was, and ultimately keep your autoimmunity at bay. Lastly, important to understand is that going from stage 1 to stage 2 could take 20 years, or you could have something like an infection or maybe a head injury progress you from stage 1 to stage 3 overnight.